discussing the differences and similarities of the United States and the Italian healthcare models. So today we will be comparing these two beautifully complex and vibrant countries for three main reasons. One, what we're able to learn from other countries' successes and failures is invaluable. The required context needed to function on a global scale only comes from staying informed on the financial and organizational standing of other countries as well. And finally, all the information that we learn from them can be efficiently and effectively applied to the U.S. policy, which then positively impacts our citizens. Italy's healthcare system model is called Servizio Sanitario Nazionale, or SSN for short. In this model, healthcare is funded through federal taxes and distributed to the local governments. There's a very low copayment, and services provided include primary and inpatient care, pregnancy treatments, hospice, and medications. It should also be noted that elderly and minors, pregnant people, and those living with chronic ailments are exempt from these medical costs. The advantages of the SSN system are staggering. With a 100% coverage rate and very low copayment costs, medical debt is essentially non-existent, and citizens are able to focus on getting stronger and healthier rather than how they're going to pay for it. It is also clear the importance Italy places on serving their vulnerable populations by completely covering all healthcare expenses. The main disadvantage of this system is that most citizens are not able to opt into private insurance, restricting their choices in maintaining health. The second biggest disadvantage is each region decides how to implement its healthcare resources, and so the northern half has better healthcare than the lower half. The United States runs on a mixture of multiple models. Most citizens utilize private insurance, often a benefit provided by their jobs. Employers pay a portion of the coverage each month, aiding in the financial burden of healthcare. For those unable to pay for these services, Medicare, which provides care to the elderly, and Medicaid, which provides care to people living below the poverty line, and VA benefits, which provides care to veterans, is funded by the national and local governments through taxes. This results in over 90% of citizens having healthcare coverage. Some advantages of this system is that there are a myriad of choices when it comes to coverage, which allows for people to individualize their healthcare a bit more. This individualization can lead to more effective and active participation in healthcare treatment. The U.S. system also focuses on the most vulnerable among them as well through governmental financial aid. Disadvantages of this system must also be mentioned to gain a full perspective of its function. The costly nature of private healthcare coverage often leads to medical debt for many Americans, and its complexity has the potential to leave people out and even take advantage of citizens. Analyzing the economic factors of Italy will provide a holistic perspective of its function. As discussed, the primary funding of Italy's healthcare system is through federal taxes. A gross domestic product that only seems to be increasing at $2.3 billion aids in the healthcare system's financing. Being the fourth largest market for medical equipment and supplies in Europe cements its grand influence on affecting funding not only for their country, but countries all around the world. Health insurance's role in Italy can be equated to an equitably shared healthcare cost system, promoting shared responsibility and focus on community well-being. This sentiment can also be shown in Italy's largest factor of increased costs, innovation. Placing money on equipment that has the ability to provide the best outcomes in the most efficient way is the costly but necessary expenditure for the fortitude of their healthcare system. In the United States, primary funding actually comes from people's employer, and our GDP is $27.72 trillion. Healthcare markets, well, we're number one in healthcare. But it should also be mentioned that the cost is over $12,000 per person. Health insurance's role is essentially just trying to increase the coverage of each citizen to improve their healthcare outcomes and well-being, in turn also helping the community's healthcare and well-being. For our increased costs in the United States, it's usually pointed to things like technology, chronic illness, as well as our large elderly population.
When comparing core quality of healthcare measures including life expectancy, maternal mortality, and hospital beds per citizen, it is clear Italy exceeds the United States in each category.
With a life expectancy of 2 years greater than the U.S., a maternal mortality rate of 5 out of 100,000 births compared to the U.S., which has one of the highest rates in the developed world.
More beds available in Italy than the United States. It is clear that there are factors of Italy that the United States system should incorporate in order to improve our healthcare delivery. Each of these measures has the ability to negatively impact the financial status of the United States healthcare system because it shows the citizens are living shorter lives, putting off preventative care due to lack of coverage, leading to more costly results, and putting themselves at risk for not prioritizing maternal care. Italy and the United States both have an epidemic of obesity and diabetes to solution for. Italy does not have the infrastructure to handle diabetes in highly populated areas such as the north. A benefit of living in the northern half of Italy is the diabetes care team has a team-based approach and often branches out of the hospital to support the patients. In the southern half of Italy, there are gaps in care and access along the continuum that they are solutioning for. Like Italy, the United States has a diabetes care regulation that mandates diabetes care must be covered. Each state is able to discern how they want to follow the law. For instance, Virginia covers all the supplies and education. Tennessee covers education and nutritionist support. As obesity takes over both countries, the rise of needed diabetes care is starting to outpace the care itself. It sets the countries up for financial concerns, especially Italy, as they cover all the costs. The United States sees the same access to quality care concerns as Italy does. Both countries need to focus on how to reduce healthcare costs by reducing obesity and in turn lowering the rate of type 2 diabetes. The rates per diabetes per worlddata.info is 6.4% in Italy and 10.7% in the United States. Health outcomes like the number of people with diabetes and the rate of obesity talk to the population health and success of healthcare systems in controlling controllable risk factors. Nursing leaders are key drivers of quality and safety of care inside their organizations. In the United States, clinical outcomes drive financial performance with bonuses for good performances and payments for poor performances. United States healthcare has been performance-based for the past few decades. First, performance volumes, and now quality outcomes. These pillars of healthcare policy directly align with a few of our DNP essentials, such as population health, quality and safety, and systems-based practice, according to 2023. If we take obesity, for instance, our United States healthcare system tackles obesity in a number of unique ways, such as calorie count on menus to help remind people of their intake, practitioners are specializing in weight loss and weight loss programs, both inside the healthcare facilities and for-profit businesses. As a nurse leader, it will be up to us to thoughtfully consider how we equip our patients both for success of weight loss and for chronic disease management. Advanced practice registered nurses do a great job of meeting the patients where they are at and holistically taking care of them. They will go one step further and figure out what the underlying cause of the symptoms are that are being presented to them, do a thoughtful assessment and diagnosis with helping decrease unnecessary testing and increasing patient satisfaction, which in turn helps our care finances. Our discussion question for you is, what do you see as the main benefit of Italian healthcare that we should consider implementing in the United States? In conclusion, Italy and the United States operate differently, yet provide value to the people they serve. We covered a number of key facts, and what we want to highlight is we feel Italy's universal coverage allows them to have some better quality outcomes because everyone has equal access to care. And the benefit that we see in the United States is that they can personalize their care. However, we know that financially, not everyone has the access they need to get the quality outcomes, as evidenced by the mortality rates for maternal mothers. Also, advanced practice registered nurses' leadership is vital to financial success through quality metrics and the personal relationship that we bring to our patient interactions.
Thank you.
Thank you.
Bye.